Oh, this is good. This should have its own section, to be honest. So we talked a little bit about side effects the other week. We kind of talked about like the big hitters. So you should know the side effects of your fast movers in your pharmacy. So,
Okay.
and this kind of just lists certain ones. So, ACE inhibitors, enalapril, um, first dose hypertension, which you get with any antihypertensive, but a specific idiosyncratic side effect to ACE inhibitors is dry cough. So if they come in, they've got a dry cough, then you kind of tell them to see their doctor. NSAIDs, ulceration in the stomach. It's one of the most. It's 20% of all medicine-related admissions into hospital, depending on what hospital, are actually related to NSAIDs.
Right.
So it's like a big thing to know. Metallic taste with metformin. What other side
Yeah.
effects do you get with metformin?
Um,
Why do
GI disturbance.
Yeah, GI disturbances. And what usually happens if they're on metformin and they've got really bad GI disturbances? What does the doctor do? So usually moves them
Is it
to gliclazide.
oh, is it glycoside, is
Yeah,
it? Right.
usually. Yeah. But you get stomach disturbances with gliclazide as well. So um, this one's a good one to know. Rifampicin, discoloration of the urine.
Yeah.
Again, levodopa as well. I mean, the way that would be formulated into a question is, a patient comes in and they tell you that they've got blood in their urine or their urine is dark, yeah, and and then they will list and they're on these medicines and it'd be like atenolol, uh, you know, aspirin, whatever.
Yeah.
What what is blood in the urine? What's that called medically?
Urinary tract infection.
Possibly. I mean, that could be really, really kind of really bad urinary tract infection. But the medical term for it is hematuria. And
Right.
yeah, if you've got hematuria with a UTI, it's a bit scary. It's a bit worrying. That would be a direct referral. But if they say that they're on levodopa as well, levodopa makes their urine dark red anyway. So you've got to think about that. Xerostomia. Did you look up the antimuscarinic side effect stuff?
I didn't.
You
I'll
didn't.
do that
Okay,
after.
that's a biggie. They always ask.
Okay.
Um, that's that. Oh, there is a section. So this section's quite useful. Most of it is in the BNF, but it's good to know a few of them off by heart. Enzyme inducers. You remember those?
Yeah, I'm familiar with
Yeah.
them.
I'm not too hot on them, to be honest. You've got to know the difference between an enzyme inducer and an enzyme inhibitor.
Yeah.
And I think they can ask you that in closed book as well. MEP. I mean, I've left this in here in the book because there are certain things you need to know at the MEP. What do you need to know in the MEP?
And everything.
Yeah. What's on page 45?
Oh, do I have to know it like that?
No. You just need to know what's responsible pharmacist.
It's the person that's it's the pharmacist that's in control of the premises at that time.
Yeah. All right. So I run a pharmacy, but
Right.
there's a pharmacist working there full time, but I just kind of like pop in here and there.
Yeah.
He then goes to lunch. Yeah, he doesn't sign out,
Right.
but because I'm there, someone comes in for a script of trimethoprim. So I just I just do it and then give it out.
Yeah.
If I gave that out and it was incorrect, Whose fault is that?
It's the other person's fault.
What should I have done?
You should have signed in as the pharmacist
Very good.
then, signed him up. Well, he should have signed out.
Yeah.
You should sign yourself in.
Questions you'll get is stuff like he's gone and he's going to make a delivery and he's out for an hour and a half. Can is he considered the responsible pharmacist? Go on.
He would be, wouldn't he?
Yeah. Yeah. Emergency supplies.
Yeah, I'm familiar with them.
Yeah. When can you give it? What can you give? What can you give?
Anything?
No, you can't give CDs. Can't give CDs.
No, you can't give CDs.
Yeah. They say you should get a prescription within 72 hours, which is 3 days.
Yeah.
And because it is to do with a prescription-only medicine, you've got to make an entry in the private prescription register.
Yeah.
I don't know if this has changed. You might need to check, but there's like a prerequisite that you have to interview the patient. So the patient really should be there within the pharmacy.
Okay.
But in practice, very rarely. Very rarely. So if like someone's mum comes in and they're like, I need some medicines for little Tommy, he needs his asthma inhaler, to be honest, you should ask for that, that person to bring in the patient so that they can do, so you can do a proper interview.
What sort of questions have you asked the little child?
Well, that's a stupid thing, isn't it? It's like, what if the child doesn't speak English or, they're too young? Do you know what I mean?
Can I read from that then to see what the latest...
It's MEP. Just go MEP, emergency supplies. But I mean, the thing is you, as a pharmacist, you do get some discretion. You need to know scheduling as well. Most important thing is this. How long does a prescription last for, Kieran?
Or normal prescriptions?
Yeah.
6 months?
Yeah, so an FP10, 6 months. How much for something with, let's say, diazepam on it?
28 days.
Yeah, it's important. And then you've got to remember, does temazepam need to be kept in the safe?
Yes.
It does. So that's the only exception with benzodiazepines. Do you know why that is? What is temazepam?
Sedative.
Yeah. But what classification? It's a benzo, yeah?
Schedule 3.
Yeah, Schedule 3. It's a benzo. The reason why it's kept in the CD cabinet opposed to diazepam or, what are the other ones? Midazolam or that kind of stuff, is that it's very short-acting temazepam. And I think what happened was in Australia, there were like lots of spouts of pharmacies being broken into by drug addicts. And what they would do is just break in and steal like all of the, codeine linked to this, but they'd also go for all of the temazepam.
Right.
Because apparently it's like a really good drug of abuse. They can on the exam, they can show you an FP10. I think it happens on every exam, and then you've just got to check the legality of it. If I am 11 years of age, does my date of birth need to be written on the prescription?
Yes.
So what if I'm 13?
No.
Yeah, so 12 is the barrier.
Yeah.
It doesn't really need to be date of birth. It can just be how old you are. So it could say like 11 years old or whatever.
Do you need to know the NHS contract?
Do you need to know it?
Yeah.
You need to know bits of it. Like, that's really in the tariff. Buprenorphine.
Yeah.
Subutex.
Yes. I know what it is. I give it out.
Do you know? But what does it do? What is it?
Isn't it like a substitute for methadone?
Yeah, but it's a little bit different. So why are people on methadone?
Because they're heroin addicts.
Yeah.
To help wean them off.
But why don't they just put them onto heroin?
Because this is less addictive.
Nope. It's pretty much the same. Okay. You know what a half-life is?
Yeah.
So it's the amount of time that a drug spends in the blood. So heroin has a very, very short half-life. Okay? So when you inject heroin, you get high really quickly, but then you get low really quickly. So it's about 2-3 hours, I think, with heroin. Okay.
Yeah.
Methadone is different. Methadone has a half-life of 3 days.
Right.
So what does that tell you in your mind?
Well, it means the effects last a lot longer,
Exactly.
so they
So
don't have to keep injecting
exactly,
themselves.
exactly, exactly. What if someone collects their methadone on day one, but then misses it for 3 days, and they come in for the fourth collection?
You can't
Yeah.
apply.
So what? So what is? So knowing that you know that the half life is 3 days, why do you think that is?
Because they may be. Hang on a minute.
Yeah, that's gone.
Is it to do with tolerance?
No, it's to do with if they're after 3 days, then the concentration of methadone in their system is halved,
Yeah.
so they're more likely to relapse.
Right.
Yeah. So they could have gone
Okay.
in, because they haven't got the methadone in their system anyway. They probably have gone to one of their dealers and got some heroin because they're getting the withdrawal symptoms.
Yeah.
So,
But,
gone.
but like you're making the assumption that they've done that and they.
You are making that assumption, and why are you making that assumption? Because what if someone takes heroin and then comes to you and gets 90 mils of methadone?
Overdose.
Exactly. Yeah.
Yeah.
So you're making that assumption, although it's a bit crap. It's not a very good assumption. It could just be
Did
that
you say the half-life for methadone was 72 hours?
it's around 72 hours. Yeah.
Okay.
Um, so you're making an assumption, but it's an important assumption. What will someone die of if they overdose on opioids? Very
Respiratory
good.
depression.
Yeah. Yeah. So pretty important. Oh, this is a good one. Yeah, you should know this. So, a patient comes in with their little child, got
Yeah.
an FP10 for amoxicillin, 250, and then the directions is 5 mil TDS for 14 days.
Yeah.
Yeah, total quantity 200 mils of amoxicillin.
Right.
What are you going to give out to that patient?
2 bottles, 100 ml bottles.
What is the shelf life of 100 mil amoxicillin made up?
Is it 7 days?
Yeah. So if you're giving her 2 bottles, isn't that a bit of a problem?
Yeah.
Because it's over 14 days. Well,
Yeah.
it's over 7 days. So what would you do?
You would give one and then keep one back
Yeah.
and then tell them to come in.
Yeah.
And
So you'd
would
give
you do?
you'd give them an Owing.
Yeah.
Yeah. You'd make up the first one for 7 days, and then you'd give them an Owing saying you need to come back. What happened? And the government knows that. it knows that you have to do that, and then they have something called limited stability. So what you do when you do that, you write LS on the prescription, and then you get paid more money.
Did you say I need to know LS and MD off by heart?
Yeah.
Okay. Can you explain? I've not really come what that is.
Okay. So we've done LS, yeah? You understand that?
Limited shelf life.
With limited stability.
Limited stability, sorry, yeah.
And it's just something that you write on the left-hand side of the prescription, LS, and then you're done. MD or MF, I think it is MF actually. MF is measured and fitted. And the scenario you kind of need to know is... Say again?
That's stocking.
Yeah, exactly. Yeah, good. Yeah. So patient comes in with a generic stocking requirement. You need to measure them. And then recommend which one. It's very rare.
Oh, we do that quite a lot.
Do you?
Yeah.
I don't think we should do it, to be honest. I think nurses should do that. Visit pharmacycpa.com for the full video series. As always, for more information, please subscribe to our YouTube channel, join our free PCPA course, join our Facebook group, or subscribe to our blog.